Hi and welcome again to DentLinks. I'm Peter Tawil,
And I am Ziad Salemi.
and it's our pleasure to present to you a challenging case that we completed together. It consists of an extraction of a mandibular deciduous central incisor that we replaced with a dental implant. And Dr. Ziad Salemi completed his restoration with a digital impression and a CAD-CAM restoration. This is a cone beam CT analysis of the deciduous tooth site, showing a very limited mesiodistal width, however, a good amount of bone height. So what we did next was proceeding into the surgery, extracting the deciduous tooth, the central, and placement of an implant, and an immediate bonded tooth to the neighboring teeth that serves as a provisional. That X-ray shows you the sequence of treatment from extraction to implant drilling. Very important to take an X-ray in the middle of the treatment, and then implant placement. We have placed a 3.3 diameter implant for a 5 millimeter width mesiodistally. The real challenge in that case is to adequately place the implant in a three-dimensional position.
This is a clinical situation 2 months post-op. And now we move to the digital impression that was taken with a trios 3 from 3 shape. So the first impression was taken on the lower part, then placement of the digital scan body, the implant scan body, according of course to the implant used. So another impression of the scan body, then moving to the digital impression of the maxilla, and you can see the movement from posterior up to the anterior side. And here you can see on the screen how fast this digital impression is taking place. So this is a finalized digital impression of the maxilla. Some tricks here is to remove all the excess by trimming. There is a digital trimming, and then you move to remove all patches, so you will have a better clean digital impression, and this will mainly minimize the weight of this file. So after everything is finalized, we move to record the occlusion digitally, of course, and we ask the patient to keep closed tight. Then we record the occlusion. So you can see it on the screen. It's a very fast and easy procedure, very accurate. So you wait seconds for the aligning, and once everything is okay, the digital impression is ready to be sent, of course, after you be sure of recording the shade. And just the worth to mention that Trios 3 have the option of shade selection that, according to the literature, is also very accurate. So we always do it, and then we use sometimes a shade selection using shade guides, different shade guides, to be sure about it. And here you can see the final placement of the zirconia crown that is placed. The aesthetic is highly acceptable. The fit is very nice. You can see it on the X-ray. And I think this is a very reliable procedure to be performed.